Hello and welcome to the program. I'm your host, Neal Howard, here on Health Professional Radio. Thank you so much for joining us today. Our guest in studio is returning to speak with us, Jennifer Steiner. She's CEO of InnerChange. Now, InnerChange is a family of residential and outpatient mental health treatment programs for adolescents, young adults, and their families. And she's returning here here on Health Professional Radio to talk about her particular counterintuitive approach to leadership and growth in the current mental health care industry. Welcome back to Health Professional Radio, Jennifer.
Hi, Neal. It's a pleasure to be here.
Thank you so much for returning. When we were here before, we talked about your core methodology there at InnerChange. We talked about some of the ways that you are changing the way that healthcare professionals, especially mental health care professionals, are relating to their clients there at InnerChange. Today, I'd like to talk about your approach, your particular approach, and InnerChange's approach to leadership and growth in the current mental health care industry as it stands. Let's talk a little bit about your background and how you came to be a CEO of InnerChange.
Oh, sure, absolutely. Well, I like to describe myself as a chronic healthcare leader. I have been committed to healthcare and serving what I call vulnerable populations for most of my career. And so my entree into InnerChange and the mental health field was just a continuance of that. But I have found that mental health is a bit different from many segments of healthcare, and so it's presented some really interesting challenges for me.
Now, being different in just the fact that it's mental health, when you're dealing with adolescents and young adults, there's even, I guess, for lack of a better term, even sometimes more of a challenge when you're dealing with, people that are, growing into adulthood and have mental health issues at the same time.
Yes, absolutely. It's been, an interesting challenge to be treating folks on what I call the front end of healthcare. Much of my career has been spent at end of life with elderly patients. But even more notably, Neal, what I have found to be very unique is that, I think the mental health field is sort of the last frontier of healthcare. It is a space that has been not generally reimbursed by payers. And what that means is that there has been very little accountability for treatment. When a care service is reimbursed, payers really motivate providers to show that what they're doing works. And given that mental health has not been supported by payers, oftentimes they haven't been held accountable to showing that what they're doing works. So I found this space to be very exciting because there's so much opportunity to be more clear and more precise around defining the effectiveness of our care.
When talking about, I guess you're talking about results-driven mental health care. In your opinion, why do you think that there is, has not been the push for more accountability, and why does that lack of accountability exist in what you say the last frontier and the front line of defense?
Yeah, well, accountability comes usually with a payer requiring a provider to do that, right? So when an insurance company says, we're only going to pay for this treatment if you can show us that it actually worked, right? And that's not historically been the way things have worked in mental health because there hasn't been a lot of reimbursement. But with the introduction of the Accountable Care Act, we're seeing a lot more reimbursement from insurers for mental health conditions, and with that has come the requirement to demonstrate that the work we're doing is effective. I mean, as a basic example, if you just think about someone in your life who may have gone to see an outpatient therapist for just maybe having some trouble, it is not a common practice that provider would sit down and say, okay, here's your presenting condition, here's the progress we're going to make along the course of our therapy, and here's the outcome that you can expect, and I'm going to be held accountable for that. Right? That's just not common in mental health, and yet it's critically important. I mean, we all know the data is showing us that the spend in the U.S. healthcare system is being driven disproportionately by mental health issues. So many chronic conditions and other healthcare conditions are exacerbated by mental health issues, but very few folks can really put their finger on, how do we do something about it? How do we ensure that we're actually making things better? And how do we demonstrate that? So this is a really big deal.
Do you think that maybe there's a trust issue when it comes to dealing with someone's, getting inside someone's head, and fixing things? Sometimes maybe, it's not like it's a heart transplant, or it's not like it's taking out the appendix or removing a leg, something I can see, it's something tangible. I can feel it, or it's not there. But when it comes to mental health, do you think that maybe there is something on the practitioner's part to foster even more trust and thereby, I guess, gaining more stride?
Yeah. Well, you've hit the nail on the head with an important issue here, which is, I think one of the factors that has made this very difficult, this measurement and demonstrating effectiveness, is that there is a bit of artistry here, right? And there is a little bit of how do I know if I'm going to give someone a heart bypass, if I did it or I didn't do it, but how do I make it black and white that the treatment I've provided has quote unquote healed someone or not? So I think that is one piece that will continue to make this a challenging task. Because it is a little less binary than other healthcare conditions. Yet at the same time, I think we absolutely can demonstrate. Has someone been depressed, and are they depressed after the course of treatment, or was someone demonstrating certain types of behaviors, and are they demonstrating them after the course of treatment? So there is some tangible, there is some things that are tangible that we can look at to see if this has worked.
Do you think that your particular approach to fostering, better leadership and communication in the current healthcare industry is something that you brought to InnerChange, or is this something that has evolved since during your tenure there at InnerChange?
Something that we do very uniquely at InnerChange is the use of relationships, that to incite change in our clients. And interestingly, we're using some of these very same principles to strengthen our organization internally. So I have taken a lot of these principles that we use in our clinical model, like relationships and like the family systems approach and working together as a healthy family system, and I've applied them to our company. So we're learning as a company to be more connected, to have real relationships, and we're actually finding that these principles are strengthening our company and helping us to be better providers. And that's pretty neat to say. The same thing that we're doing to heal clients is actually healing ourselves. So.
Have you seen any other models that even come close to this model of yours? And is this something that is totally brand new, and how long has this approach been around?
That's a great question. I mean, I think companies over time have certainly looked at how they're interacting with one another and the importance of culture, and applied those concepts to strengthen their companies. So I'm certain that many of these concepts have existed in pieces and parts through other companies. But I would say this is a pretty unique approach to actually take a company's own clinical model and apply it to itself. And I would say that some of the principles included in our model, things like, really motivating folks to be in relationship with one another and to be collaborative with one another, are a little counterintuitive to what I would deem as widely accepted business practice. Yes. So I think that's pretty unique.
And where can our listeners go and get more information about InnerChange and this counterintuitive approach?
Well, you can certainly visit our website, which is InnerChange.com, INNERCHANGE.com. And we talk a lot on our site about our core methodology and how we're using that to grow as a company.
You've been listening to Health Professional Radio. I'm your host, Neal Howard, in studio with Jennifer Steiner, CEO of InnerChange. It's been a pleasure talking with you today, Jennifer.
Thank you, Neal. It's been a pleasure.
Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm and you can subscribe to this podcast on iTunes.